Well, good afternoon, everyone. Welcome back to the afternoon session of the 15th annual meeting. And this portion for about the next 20-25 minutes is our business meeting. And this is your organization, and we're pleased to have you participate in a little bit of the housekeeping, if you will, and hear a little bit about where we stand in our programs, in our finances, and in our leadership development. So we're going to just take about 20-25 minutes to do that before we move back into our program for the day. So we're going to forego a roll call because we have registrations, and I need a motion to approve the consent agenda, which was in your packets from our last meeting. May I have a motion? All right, thank you, Sharon. Second, thank you.
Cap second.
Any discussion on that motion? All in favor, aye, please. Opposed? Thank you. We've adopted the consent agenda. So the first item on our business meeting agenda is to hear from John Clymer, our Executive Director, on the status of the organization as a whole in our programs. John?
Thank you, Dave, and thank you all for being here. As Dave said, this is your organization. You make the National Forum happen. You put the power in the National Forum. It's nothing without you. So thank you for being here and for your participation today. The National Forum has 4 strategic imperatives in our business plan, and I will just quickly go through those imperatives, and that will be my report. So the first imperative is to proactively set the collaborative agenda for the National Forum. What does that mean? It means no wag the dog. So we're not responding to sponsors who say, hey, we have a job we want done, or we have a study we'd like to commission. We, in concert with members, set our own agenda. Well, what does that look like? For one example, our Value and Access Initiative came about as a result of Sukub and other people in the room coming to the National Forum saying, our organization wants to be more actively engaged in the national debate about the value of innovative therapies and access for patients and people to those innovative therapies. But we aren't quite ready ourselves to get out there on the playing field and duke it out with some of the other players who already are there. So we want the National Forum to help us prepare and engage in a constructive way. So the National Forum brought together, after doing a bunch of research and proactively listening to members, and the results of which are in a report that's available on our website. We brought together organizations, many of you in the room are participating in this, representing patients, providers, public health, pharma and biotech, and payers, all around the same table. I'm not going to elaborate very much on this because you'll hear more about it in the next session. Suffice to say, this is something that is driven by the National Forum responding to our members' requests, our members setting the agenda and the priority. So it's a good example of our proactively setting the collaborative agenda for the National Forum. A second example is our Move with the Mayor initiative that's engaging mayors as leaders of communities around the country to promote better cardiovascular health and prevention by getting people up from behind their desks or off their sofas and away from the screens and engaging them not only in physical activity but in some of the things that Clay Marsh was talking about in his comments, that connectivity with other individuals that's such an important component of health and well-being and preventing cardiovascular disease. So that's something that we started, and I'm very excited about the fact that the power of that and recognizing that mayors can be a really catalytic force in their communities has been recognized by a number of people, including the CDC, who has just awarded us some funding to support that program. So that's very exciting and a good validation that we're making an impact there. I want to pause for a moment and let you hear, not from me, but from the mayor of Oakland, California, Libby Schaaf, who will tell you in about 70 seconds why she's involved in Move with the Mayor, working with our organization. And hopefully
I
you're
have
a good lip
had
reader.
the best time holding Move with the Mayor during the month of September. Move with the Mayor was an invitation from me to people who work all around the City Hall area to come during their lunch break. We did a little line dancing, a little warm-up, and then we just took a brisk walk around a few blocks of downtown. This was a way of raising awareness about stroke and heart disease prevention, which are two very serious health risks here in Oakland and in Alameda County. But more than that, it was a fun way to build community, to show people that you don't need spandex or fancy clothes or a gym membership to get out and exercise a little bit. That you can just wear what you wore to work that day, enjoy being part of a community, and get a little exercise. So I encourage every mayor to hold a Move with the Mayor in your community. Not only will your constituents appreciate the great message around health, but honestly, it will make you feel good yourself. So please, move with the mayor.
So we've had a number of mayors and members involved at the community level in this. The American Heart Association, for example, was very engaged in Toledo, Ohio, in helping to provide screenings and patient education for the public at a number of different sites, and working with not only the mayor's office and the public health department. They engaged first responders. So on World Heart Day this year in Toledo, at the mayor's behest, every firehouse was opened up to do blood pressure and cholesterol screening in concert with a local health system and the public health department. So that's the kind of thing, and the AHA was there providing patient education. So that's the kind of collaborative force that we think we can mount working together to move the needle on health at the community level. We are making an impact. We now know that. This started just 3 years ago. One of the first mayors who was involved with it is Jim Schmidt, the mayor of Green Bay, Wisconsin, and he told us very excitedly just a couple of weeks ago that in a city with a $106 million budget and $13 million of that going to employee and dependent health care, this year their employee health risk assessments, the scores have gone up each year since they became involved in Move with the Mayor, and it's extended. It's not just promoting walking to everybody, but it's actually changing social norms and having like walking meetings, for example. So this year, they are going to have an increase in their city healthcare budget of 0%. 0%. So that's huge, a huge change from where it was before. So that's a message that I think can be carried to a lot of communities around the country, and we can start a fire that will lead to improved health elsewhere. So the second strategic imperative is to engage current members and diversify our membership. And I'm really proud of the banner that's over here about all the different sectors that are represented in our membership. And I'm pleased to say that we've already outdated that brand new banner because we're now over 90 members. So the membership is growing, and I think that's a result of those members who are actively involved in the Value and Access Initiative and other programs, bringing other organizations, like-minded and organizations with similar goals, into the forum. So we are growing, and we're engaging our members through these different initiatives that help you carry out your agenda and achieve your goals. So the third strategic imperative is to optimize our resources and to expand the resources for sustainability. And Laura Gordon will give the Treasurer's report in a moment, which will show that even though these are kind of uncertain times and we're experiencing sponsors having budget cuts and concerns about what's happening with federal funding and so forth, we're safely in the black and growing. And then fourth is to establish the National Forum as a thought leader and a change leader in cardiovascular health. That's not for the National Forum to do it by itself, but to provide the boat for all of you to board and to row to reach where the finish line that you are aiming toward as well by rowing together with one another. And Move with the Mayor, I think, is a great example of how we identified a catalytic force that population health had not tapped or tapped effectively before in the form of the elected leaders of communities of various sizes around the country, and the way that they share information with one another and the way a good idea can catch fire with among that peer group. So I think that and what you'll hear in a few more minutes about value and access will give you a good example or some good examples of how we are helping you drive change.
Thank you, John. Excellent report. And the discipline you brought to that description is, I think, characteristic of how you're helping to lead this organization. We stay focused, using resources as efficiently as possible, and really listening to the members for priorities and opportunities. So any questions for John at this point? All right. Well, thank you. We'll move then to the Treasurer's report and invite our soon-to-be non-treasurer, Laura Gordon, to provide an update. Thank you.
Oh, I really will, Dave. So I always joke every time I give this report on our meetings. I always talk about how this is everyone's favorite part. So prepare to enjoy the scintillating finances. But the good news is it's actually a great story in these numbers. So I'll try to make it as interesting as I can. As John said, it has been a challenging year. We have had budget cuts. I think we're seeing this in every industry, private sector, public sector, so not a surprise to all. But the good news is that, as Dave just mentioned, I mean, the resources that we do have are being used in such efficient and positive and effective ways that we're working within that and getting creative when needed. So I'll read the August financials, which will be August as well as year to date. So our August statement of financial position, our balance sheet, shows that through the first 8 months of 2017, National Forum has a positive financial condition, as John said. We have $698,203 in assets and less than $1,000 in liabilities. Our net assets have increased by $171,847 since the beginning of the year. The statement of activities income statement for the first 8 months shows that our revenues exceeded our expenses by $246,871. So as I said, a very positive story there. Our costs are below budget for nearly every line item, and importantly, that is not because we're starving programs or deferring expenses. That's because of very careful management of our expenses. So just to get specific in a few areas, so our August 2017 balance sheet comparisons, our net assets, $697,907. That compares to a year ago, very similar, $709,473. Changes in our net asset comparisons. So August of 2017, revenues were about $30,000. Compared to a year ago, a little bit different, $431,285. But again, our expenses were $48,660 a year ago, $127,609. So differences that are clearly aligned. Our revenues are on budget as of September 30th of this year. So 2017, our year-to-date revenues are at $811,029 compared to last year, $1,004,000. Our year-to-date expenses for this year are $564,158 compared to a year ago, about almost an even $1 million. Our bank accounts are nice and healthy as of October 1st in Wells Fargo. Our checking is $221,160. Our savings is $290,693. That's a total of $519,854. So I did all that math in my head. I hope you know. With that, I would need a motion to approve the Treasurer's report for the August 2017 financial statement. Warren, did you move? Oh, you just waved. Oh, sorry.
Any discussion? All in favor, say aye. Opposed? Thank you very much, Laura. We appreciate your work as treasurer among the many ways, as I mentioned earlier, that you contribute, but it's been important to help us navigate through this phase, and you've done a tremendous job. We appreciate it. So the next item on our agenda would be our board nominations, and if I could get that slide. There are the numbers. And it would be the next slide, I imagine. All right. So our executive committee, acting as the nominating committee, proposes a slate for 2-year terms as directors. And I imagine that the next slide has the names, yes. So this would be to elect the following individuals for 2-year terms as directors: Jennifer Robinson, Warren Jones, Javed Butler, Laura Gordon, and Celeste Phillip. Are there any additional nominations? All right, then if there are no additional nominations, I would ask for a motion to approve the slate of directors. Thank you, Sharon. A second? Any discussion? All in favor? Aye. Opposed? Thank you. Thank you. I think there's a great team there to continue to help guide the National Forum forward. Also want to mention that yesterday our board elected new officers, and Laura Gordon will become the vice chair, Warren Jones secretary treasurer, and Jennifer Robinson moves from vice chair to chair. Thank you. At this point, Jennifer, I think you're going to manage our awards.
Oh, I have to stand up. I can't sit. I don't know how we're going to, how are we doing this? So the people, okay. Okay, so we'll ask the award recipients to come forward as their names are called, and then stand next to the dais. Is that where the awards are? That's what I was trying to find out. Okay. And so these awards are to recognize individuals and organizations who have made exceptional contributions to heart disease and stroke prevention. And so our first award is, and I think we're going to present all the awards and then hold your applause to the end. So the National Forum Heart Healthy Stroke Free Award is presented for both an individual and a group whose work embodies the recommendations of the Public Health Action Plan to prevent heart disease and stroke. And our individual recipient is Steve Sidney, whose wonderful report we saw earlier today. And our next is our organizational recipient is the FH Foundation, who is represented today both by Bill Neal, one of the founders, and Kat Davis Ahmed, vice president. And so the next category is the National Forum Public Policy Awards. And this recognizes an individual and a group who have been effective in advancing policy changes that reduce heart disease and stroke burden on a national, state, or local level. And the individual recipient is David Hoffman from the New York State Health Department and the National Association of Chronic Disease Directors, who is not with us today. And the organization is the Center for Value-Based Insurance Design, who also is not able to be with us here today because I believe they're presenting something on Capitol Hill. So in with the theme of this award. The next set of awards is the National Forum Commitment Award, and it's given to an individual who have made outstanding contributions to the National Forum. And the 2017 recipient is Emmeline Ochai from the Office for Disease Prevention and Health Promotion at the Department of Health and Human Services, so one of our governmental partners. And the National Forum Chair's Recognition Award is given to an individual who has made outstanding contributions to the prevention of cardiovascular disease. And we have two individuals for this award, both from the FDA. Dr. Helene Clayton-Jeter was not able to join us today, but we gave her her award last night. And Fred Senatore, who is with us today, who have been instrumental in really leading initiatives on adherence. I'd also like to recognize Sharon. Sharon, there you are. Thank you so much for your contributions over the last 8 years to the National Forum, and we really appreciate it. And I hope you're still with us even more years. All right. Thank you very much. And last but not least, our esteemed, now not quite past president, but Dr. Dave Zook, as our outgoing chair, in appreciation for your service this past year to the National Forum, as well as continuing to help me, I hope.
Yes.
Okay, thank you. Next year. Thank you, and let's all give all of these individuals a round of applause. Thank you. Are we good? All right. That'd be great. And this is Dr. Jerome Adams, the Surgeon General of the United States.
cardiovascular disease in my family, and I'm very excited about the work that's being done here. Not so excited about some of the athletes you all have heard about today and the trends we're going in. But we've got to continue to raise up this issue, to highlight the great work that's going on and share positive examples. And so I wanted to get a picture so that I can post that on my Facebook and my Twitter pages. And spread the word that we are committed to doing what it takes to overcome these negative trends that we're starting to see. So thank you all very much for the opportunity to photobomb.
Better help through better partners. Exactly. Thank you.
But just a couple more items. Call for new business. Okay, and seeing none, I would call for a motion to adjourn the annual business meeting. Thank you. All right.
Thank you. I guess I'm ex-chair now, but a moment of chair privilege, I guess. I do want to pause for a second and recognize the team that has brought the meeting to you today in significant part. The National Forum staff that have worked hard on our mission every day, and in particular on this annual meeting. So I'm not sure if they're all in the room or close by, but Julie Harville, Debbie Martinez, and Mary Jo Garofoli. If you're not in the room, I would like to invite you in, Debbie, and just to be for a moment recognized for the work that the team has done in preparing and executing on the meeting. So thank you very much.